South Africa has recorded 1,731 new COVID-19 infections in the last 24-hour cycle. This takes the total number of confirmed cases to 735,906. The National Health Department has also reported 40 new deaths, taking the death toll to 19,789. The number of recoveries in South Africa has risen to 678,738. This leaves 37,379 confirmed active cases. Well, according to research from the first quarter of 2020, South Africans were under severe financial strain even before the COVID-19 outbreak. The pandemic has caused a lot of financial turmoil within the business sector and households, while many countries have reopened their economies, allowing a cautious return and economic life. Households still face economic uncertainty. And for more insights on how we can save money and manage our finances, we are now joined via Skype by Yehuda Kay, the head of short-term and medical aid at Octagon Financial. A very warm welcome to you, Yehuda, and thank you so very much for joining us here on SABC News.
Thank you for the opportunity, Claire.
Well, Yehuda, the year is drawing fast to a close. What cost-saving advice would you give to people either taking out medical aid for the first time or considerations on their current policies?
I think that one has to really realize that going forward, there's going to be more of a cash flow crisis than a premium crisis. And what I mean by that, your medical aid has to be able to provide the health needs that you're going to require. So it's not a matter of whether I afford the premium. It's really a matter of, have I got the correct plan that can pay for my medical aid needs? Now, there are 32 different medical aid. Just on Discovery, for example, there's 26 different platforms that you can choose from. And in tough economic times like this, you really need to have a plan where the medical aid works for you and you get the most out of it. And it's not a matter of ensuring that you have a hospital plan, because you might be paying a, but yet you don't have the cash flow to go for doctor. So it's really essential that you spend a lot of time understanding what your medical health needs are going to be for 2021 and ensuring that you find a plan and a medical aid. It is a time to be very, very cautious and ensure that you spend your money correctly on medical health. With regards to short term, I think just shop around as much as you can, because short term means losing clients on a very daily basis, and the more you push them for discounts, the greater the discounts you'll get. Now is the time to push your insurance companies for as much discounts as you can.
Yeah. Yehuda, we're always told to kind of guard our finances and just on a general level. I mean, we're getting to, that festive season or the lead up to the festive season. We all have some kind of expectations for ourselves at the end of the year. Our children have expectations, our families have expectations. How do we manage these, especially when you feel like, you do have a little bit of money left to kind of split, which isn't necessarily the reality for many South Africans, but maybe if you did get that little bonus or whatever it was, the first thing we would think is to splurge, change some things in the house or do all of that. But how do we kind of guard ourselves or stop ourselves from spending on things that might not necessarily be that beneficial?
Well, priority number one is to make sure that you have no debt that has interest bearing attached to it. So should you be lucky enough to get a bonus and or 13th check this December, it is one of those years where Xmas presents and this family really need to get back to interest bearing debt. Credit cards, if you can't afford your body, if you can't afford your car repayments, that is essentially where your bonus needs to go. Because we entering 2021 no clear confidence that you're going to have a booming economy. The opposite. So prudence needs to be the order of the day. I would ensure that if you have money, pay off your debt. And if it is up to date, I would even go further and ensure that you pay forward. Make sure that you're 1 or 2 months ahead, because job market is not secure. Increases next year are not secure, and prices of living and cost of living is skyrocketing. So, sorry to be the bearer of bad news and gloom, but I wouldn't use that bonus for presents or anything this year. I would really use it to your own personal financial debts, and planning for next year. Okay. And if there is opportunity, I would set aside some savings, because next year is going to be a very difficult.
Yehuda, it's been a great pleasure speaking to you. Thank you very much for your input. Unfortunately, we're struggling a little bit with the line, so I'm going to leave it there. But thank you, as always, for being with us. Yehuda Kay, Head of Short-Term and Medical Aid at Octagon Financial, really helping us to unpack the issues around our finances and really being a little bit more prudent. And as he said, if you can, rather not be buying all those gifts. I don't know, for those of us who do have children, it might be a little bit difficult.